Good afternoon, colleagues. This is Roy Wadia. Welcome to the COVID-19 session for the 29th of November. And as we always do, we'll start with our panelists. And we have first off the top, and I hope he's there, Dr. Rick Brown from the World Health Organization, Thailand Country Office. There you are, Rick. So over to you for your summary. Thank you so much. We can't hear you, Rick. You're on mute. Maybe you could unmute. Thank you.
Yeah. Hi, good afternoon, everyone. I'm actually going to turn my camera off now. And someone else is operating the slides for me. Just to maybe introduce myself, because I haven't actually attended one of these sessions before, but my name is Rick Brown, as Roy said, and I'm overseeing the COVID response in WHO Thailand, but my responsibilities are really to support the government response. So what you can see in this, at the top of this slide is not a mistake. Unfortunately, we normally update this slide set on a Tuesday. So this is really describing the situation until almost a week ago. It's not really up to date, but the situation has not really changed very much. Although having said that, today, in case you haven't seen, the numbers of confirmed cases reported is just 4,753, which is the lowest it's been for really quite some time. But the overall main messages are that cases remain high in some provinces. If there is more reopening, it will provide more opportunities for transmission. And then, so it's still essential that everyone, if you've not already been vaccinated, or if members of your family have not been vaccinated, you should try and get that done. And that we should all continue to maintain these individual level personal protective measures that we know can break chains of infection. Next slide, please. So this is a slide showing the global situation until a week ago. And as I think you know, we are moving into what seems like another wave, despite, and I should have said I am going to provide an update with some information about this new variant of concern at the end of it. So, but even before the emergence of that variant, however that situation itself might evolve, case numbers have been increasing, and this is mostly being driven by an upsurge of numbers in the European region of WHO. Next slide, please. And yeah, just some something on the national situation. So next slide. So as you're aware, the situation in Thailand has been steadily improving since around the end of July, despite the or it's continued to improve, even though there have been steps taken to open up the country and revive the economy. And in fact, I think, you know, given that the last relaxation of measures was on the 1st of December, if there was going to be a rebound, we probably would have seen some sign of it by now. So I think the fact that even today there's a low case number being reported, it's really quite encouraging. But nonetheless, the total number of cases in Thailand that have been laboratory confirmed has passed 2 million. The number of deaths has passed 20,000. And at least for the cases, it's almost certainly an underestimate. At the same time, levels of vaccination are steadily increasing, and they're now starting to get to the level where they are going to have a really significant impact, particularly in reducing the likelihood at a population level that lots of people are going to get sick and need hospital admission. Next slide, please. And then next slide. So I'm not sure if you will have seen a slide like this before, but I found it quite interesting. So this is trying to look at some of the data from the individual province level. And what you may be more used to seeing is, if you see data from provinces, is the number of cases reported on a daily basis from each province. But actually the provinces in Thailand are a very different size and have quite different populations. So what this data is showing, and again, it's the cases per million in the 7 days up until the 22nd, are the infection rates. So the number of cases per capita for each province. And it shows quite an interesting situation. So you can see in the column on the left, it's got a 1 to 10 followed by Bangkok and the national rates. And maybe you should ignore the color coding. The yellow is really just highlighting which one of these provinces are in border areas. But if you look down the third column to the rate cases per 1 million population in Bangkok, it's 775, whereas the number one is Songkhla with 2,509. And actually 8 out of 10 of the provinces in the top 10 are in the south. So there, and to an extent, this is still the situation today, that there does seem to be a bigger problem in the south of Thailand than anywhere else. But I just find it interesting that, you know, every day we see a high case count from Bangkok, but if you look at the actual rate, then the situation appears quite different. Next slide, please. And again, this is, I'm showing this slide partly just to, you know, make you aware that data is available now, publicly available, that allows to track the situation at individual province level over time. So again, this is these top 10 provinces, but showing how the case numbers are changing over time. And as you can maybe see, in the majority of these provinces, although they're reporting high numbers, the situation is improving. And the two exceptions are the pink line, which is Songkhla, where at least up until a week ago, case numbers were high, and I think they're still remaining quite high. And Ratchaburi, where there seemed to be a particular problem. And you may be aware there seemed to be a quite big outbreak in a prison there a few days ago. So next slide, please. Okay, and this next slide. The situation with vaccination. So again, the numbers are higher than this now, but it's really just to illustrate that there is steady progress being made on vaccination, with even looking at people who've had at least a second dose. It's now more than 50% of the total population, and it's exceeded the rates that were initially set by the government of Thailand for vaccination of a first and a second dose. Next slide, please. The situation, however, amongst high risk groups particularly is a little bit different. So, you know, bearing in mind that these risk groups, we're really looking to vaccinate 100%, not a lower target. So, I mean, the numbers are better than they have been. I mean, they're significantly better than they have been in the past, but still, there's only 65% of people with comorbid medical conditions at greater risk who were fully vaccinated until a week ago, and just 60% of people over the age of 60. But I think the ones who are really a big concern are pregnant women. And I think there is now quite good evidence that vaccination against COVID-19 in pregnant women is safe. But there seems to be a significant problem with vaccine hesitancy. And we've heard that this is not just among pregnant women, it's also in some cases amongst the clinicians who are looking after them. And in fact, as you may be aware, the really big problem is that pregnant women are significantly at risk of getting more severe disease if they do get infected with COVID. I mean, sorry, I'm just going to try and find the actual numbers. So we were in a meeting last week where it was reported that 5,700 pregnant women had become infected with COVID since the beginning of the outbreak, and 102 of them have died. So that's a mortality rate of almost 2%. Whereas for the population as a whole, the case fatality rate, based on the numbers we have, is more like 1%. But of course, that is including people who are elderly, who have comorbid medical conditions. Whereas really the valid comparison would be to compare the case fatality rate in pregnant women with COVID against the mortality rate in pregnant women who don't have COVID. So, and we're trying to get hold of the data to kind of make that estimation, but I can't stress enough how important it is that that pregnant women should try to get vaccinated. Next slide. So again, this is just to illustrate that although overall vaccination rates are improving, there's still a large variation between provinces. So the chart on the left is looking at the top 10 provinces, and the chart on the right is looking at the bottom 10 provinces compared to the national average. And you may notice that many of the provinces in the bottom 10 are in the northeast of Thailand. And I think the reasons for that are probably a little bit complicated. I think there may be more vaccine hesitancy, but I think probably a lot of these people are living in relatively rural areas where there may be some issue around getting physical access to a place where they can get vaccinated. But still work to do. Next slide, please. Okay, could go to the next slide. So this is really you may have seen this one before, but it's really put into flag that, so CLM is referring to Cambodia, Laos, Myanmar, that the case burden, the proportion per head of population of migrants who have been infected with COVID is approximately twice the rate in migrants that it is in Thais. And at the same time, we know that vaccination rates in migrants are suboptimal. I mean, it may be the case that, you know, on the whole, migrant workers are relatively younger and relatively healthy, but still, you know, on the basis of equity and health security, a lot more work needs to be done, I think, to facilitate access to vaccine for our migrant workers. Next slide, please. Okay, and next again. Again, you may not have seen this, but I thought it was quite interesting that this is the results of a survey that has been repeated over time, looking at adherence of members of the public to the public health and social measures. So you can see the chart is kind of between 0% adherence and 100% adherence. And then the color of the different lines corresponds to the different individual measures. So the green line is for wearing masks all the time, the blue line is for hand washing, and so on. So you can see around March, there was a really big dip. And it's not completely clear why that happened, but it must have, I think, reflected complacency setting in. And then when the next upsurge of cases came, I think probably associated with the Delta virus spreading, compliance or adherence increased a lot. But what we've seen more recently is that the adherence rates are dipping. So I think this is people relaxing, and you know, the basic message is that we should not allow that to happen. I mean, I think, again, the reasons why we're seeing this upsurge globally, and particularly on Europe, again, is a little bit complicated. But I think one thing we do clearly see is in some of those countries that have high vaccination rates, their individual level compliance with these public health and social measures is extremely poor, and this is not helping the situation in their countries. So, you know, the message is that everyone, you, your families, the communities that you live in, can make a difference. And it's not about telling people off. It's really about saying that you have agency. You can actually make a difference, because at the end of the day, we know how COVID is transmitted, and we know how to interrupt transmission, and it is by applying these basic, simple measures that are easy in theory to do, but sometimes it seems very, very difficult for us to actually walk the talk. So next slide, please. Yeah, and this is just, okay, next slide, please. This is something I put into this presentation just because I thought it was kind of interesting that I hadn't come across this acronym before, VUCA or VUCA, which again, up until a week ago, was really trying to summarize the kind of broad vision of the government in going forward in tackling COVID. So the V is vaccination to ensure 70% coverage or 100 million doses. You might be aware that the plan was to try and get 100 million doses by the end of this month, and I heard just this morning that apparently the timeline has been extended to the 5th of December. Then U is the universal prevention, which are the measures that I just was really advocating for. C is COVID-free setting, so all the measures that are being applied to restaurants, you know, places we go to shop, to try and ensure that they don't become foci of transmission. And a bit related to that is A for ATK. So the plan really was, well, the idea was that using antigen test kits would be a key intervention that would help reduce transmission by undertaking individual and kind of more like mass screening in community and risk venues. Starting already, there is this so-called vaccination week. I think it's clearly being timed to coincide with 5th of December, which, you know, is an important anniversary here. So really a push to try and increase vaccination among the elderly, particularly bedridden patients in the migrant population. So next slide. Okay, so we come to this new VOC, Omicron. Next slide, please. So as I'm sure you're aware, this new variant was designated as a so-called variant of concern by WHO on the 26th of November. And this is really based on two things. One is the genetic profile. So the virus, when it is sequenced, has multiple mutations, many of which are on this spike protein, which we know is important for the virus to gain entry into host cells, but also some concern about increased transmissibility. And I think in the next slide, I've got something that will help illustrate that. And as you know, cases have already been reported in multiple countries, and I'm just flagging these because I think they're particularly significant. That there was a case in Israel, ex-Malawi. The case that was reported wildly in Belgium had travelled from Egypt through Turkey. And then there are a couple of cases reported more recently in Canada, ex-Nigeria. So in all of these, these are countries that were not really on the list at the beginning. So I think it illustrates that there has already been spread from country to country to country of this variant. And also, it's a little bit difficult to understand this next bullet, but as you may have heard, the Netherlands screened 624 arrivals from South Africa, and 61 of them tested positive for COVID-19. And we understand that everyone before they got on the flight was either fully vaccinated or tested for COVID. So it's quite surprising that so many of them tested positive on arrival. And I'm not sure that we have a good explanation for that. But so far, of the ones who tested positive for COVID, 13 have been confirmed with this variant. And I'm sure we'll be getting more information on that sometime soon. But I just want to just flag before I go on with this presentation that, you know, my experience in a situation like this is that there are many uncertainties in a rapidly evolving situation, and sometimes you will see information that's hard to interpret, or often even contradictory. And sometimes I think, you know, public health practitioners are not always the best people at communicating uncertainty or uncertain information. But with time, the situation should become much more clear. So next slide, please. So I'm trying to flag what we know and what we don't know. So on the question of transmissibility, the most recent update from WHO is saying the situation is unclear. So my understanding again is that, you know, we can't really tell what's happening in countries out of South Africa because they've just been sporadic cases. So we really have to look at what's happening in South Africa to understand this. And my understanding is that that vaccination rates are not ideal in South Africa, but particularly they are lower in younger people. And most of the transmission that's been seen in South Africa is in young unvaccinated people. I think one thing which is mentioned in another slide, one thing I have seen is that natural infection rates in South Africa are actually quite high. So so there has been significant spread and people being infected with one or other strain of the virus, and this should have conferred some immunity to them. So even though vaccination rates might be low, you might expect some immunity through natural infection. But what has been reported is what you can see in this bar chart, where within this one province that seems to be the epicenter, there's been quite a steep rise in case numbers. And when they plot, I'm sorry, actually, you can't see the legend on this, but what it is showing is both the case numbers and the what we call the base reproduction rate. And it's showing that the reproductive rate is approaching 2. So what this means in kind of epidemiological terms is that according to the most recent information available in this slide, it appeared that for every one person that was infected in this province, and many of them we know have this variant, each person was infecting 2 other people. And this is a situation where, you know, if these rates of spread are allowed to continue, then case numbers can rise very rapidly. But one caveat is that this is data from a relatively small geographical area and relatively small numbers. And so, you know, I'm not sure anyone necessarily thinks this is the case, but it is theoretically possible there could have been a super spreading event amongst students, which, you know, where one case infected many different people who then went on to infect some other people. So this kind of explosive rise in numbers could be explained if there was a super spreading event. So the point is, maybe this happened, maybe it didn't, but there are things we can point to that might say this is an anomaly, that this is difficult to interpret. But it's this data in combination with these mutations that are making people concerned. And then again, for what do we know about how severe COVID infection is in people who've been infected with this variant. And again, it seems very unclear. There are reports of increased hospitalization in South Africa, but that may just be a consequence of there being more cases. So more cases means more people getting moderate infection and needing admission to hospital. It doesn't necessarily mean that all these people are getting more severe infections. And in fact, there have been, maybe you've seen as well, there have been some reports by clinicians in South Africa that most of the cases are actually mild. So again, it's genuinely unclear, and but time will tell. In terms of the clinical presentation, there's nothing to suggest that the way the constellation of signs and symptoms that people get is any different from COVID infection we've seen so far. Next slide, please. So the first bullet here is something that I mentioned already, that there is some preliminary evidence that suggests there may be an increased risk of reinfection with this variant as opposed to other variants of concern. So I think this is a little bit alarming. It's suggesting that, whereas people that were originally infected with the native strain, or maybe with the beta strain, were quite protected from getting Delta infection. But what seems to happen now, if this is a genuine phenomenon, is that people who've had past infection with another strain have a relatively increased risk of reinfection with this variant. So it's suggesting that really the native natural immunity that you get from a previous infection is probably not protecting people against this variant as much as we have seen in the past. But yeah, we still need more information, more data to confirm. As regards effectiveness of vaccines, we really have no information. But as I've written here, I think it is likely that many travelers to other countries have been vaccinated. So at least some people, I think we can be fairly confident that at least some people who have been vaccinated have got infected with this new variant. We also don't know anything really about the effectiveness of current tests, but travelers are being laboratory confirmed in South Africa when they've traveled to other countries. So it's really an absence of good information, but there's good reason to think that vaccination will protect. There's good reason to think that our tests will still continue to be working. And then the last bullet on the effectiveness of current treatments, the statement that's been issued from WHO suggests that at least some of the treatment, corticosteroids and these interleukin-6 receptor blockers, will still be effective for managing patients with severe COVID. And I think it's based on the pathology of infection, which is not specifically related to the strain of virus. So it's like the mechanism for this type of severe infection should be the same, and therefore we think these types of treatments will continue to be just as effective. But for other treatments, the ones that have been reported more recently, it may need to be confirmed. But maybe the most important, what I've tried to highlight in red here, is that there is absolutely no reason to think that our current public health and social measures will not work. So as some of you may have heard me say before, COVID has not invented new ways of being transmitted. We know how it's transmitted. It's transmitted by the respiratory route, and sometimes by contaminated surfaces, or by if we get contamination on our hands. And we know how to interrupt transmission by these routes, and all the basic individual level protective measures that we all know about will continue to work. So again, you have agency, You can make an individual difference. You can make a difference in transmitting infection onto other people. Next slide, please. So, as you might expect, WHO has put out recommendations which are that countries should continue to enhance surveillance, do more sequencing of COVID cases that are detected. Countries should continue to share these sequences on publicly available databases, undertake field investigations and lab assessments, continue to report cases and clusters to WHO. Countries should continue to apply at community level public health and social measures according to local risk analysis and using a science-based approach. And again, we all continue to apply the individual level public health and social measures, and you know, and again at a global level, do what is possible to try and address vaccine inequity. Next slide. I think it's the last slide. So what are the implications for Thailand? So there are no reported cases to date. I think it's inevitable, actually, that this variant will be reported here, imported here at some point in time. And it's more likely to happen soon through air travel. But if that doesn't happen, I think if it does get imported to a neighboring country and spread in a neighboring country, it'll be extremely difficult to stop it from being imported across the porous land borders. But the consequences of importation, it's just impossible to assess, you know, until more information becomes available. Having said that, I think you know, even if it does only cause mild illness, if it is more transmissible, there are still, you know, as I've mentioned, relatively large numbers of people at risk of COVID who are unvaccinated. And there are these disparities in vaccination rates across provinces. So I think it's just another reason why all efforts need to be accelerated to try and increase vaccination, but also again to apply these public health and social measures that we know work. I think one thing, I mean, I'm not going to speculate about what Thailand's going to do, but I think, you know, this test and go policy probably does represent something of a risk. But having said that, as you may know, people, to qualify for this test and go policy, you have to be fully vaccinated, but travelers also have to have been in their country of origin for at least 3 weeks before travel. And I think this is actually, in hindsight, a really smart thing, because it should work as a really effective buffer. Because if someone, you know, travels from country A to country B with this variant, then they should be picked up before they might even consider traveling on to Thailand. So I think this is definitely going to at least buy some time until there is more clarity around the epidemiological and clinical features of this variant. I do think this policy that's being talked about of changing from PCR testing on arrival to antigen test kit, use of antigen test kits, will probably need to be reconsidered. And I just flag, maybe there is actually going to be a press briefing by the Ministry of Public Health on this variant. So maybe there will be more information available then. So I think that's my last slide. Yeah, and any questions?
Thanks a lot, Rick. Yes, we do have one question for you. Actually, we have more than one, but we're going to ask you this one first, and then we're going to go to Dr. Theo Lisa, and then come back to you for the other questions. So the point of clarification here on vaccination in Bangkok, is it true that 100% or close to 100% of people in the city have actually gotten their second vaccination dose? And also, what is the Bangkok population figure generally used to calculate this coverage? Would you know that? Thank you.
So I can't really give a definitive answer to this, but I think almost certainly the vaccination rate is not 100%, and the problem is the what we call in epidemiological terms the denominator. So I think what's happened is that some people who are not actually resident in so either the number for the population in Bangkok is not accurate, and I've heard that may be the case. But I think also what's happening is that some people from other provinces are traveling to Bangkok and getting vaccinated in Bangkok, and so rather than being counted as a case from another province, they're being counted as a case for Bangkok. So again, I'm really sorry, I can't give a definitive answer, but I think it's, it kind of makes sense that there will at least be some vaccine refusers in Bangkok.
Sure, but
in fact, we've seen the same thing. Sorry if I'm butting in, reported for healthcare workers that the vaccination rate in healthcare workers was more than 100%, which is obviously impossible. But it's a data issue essentially.
But it would be fair to say that the coverage rate in the city is pretty high as of now.
Indeed, yeah. That is correct.
Great. So we'll come back to you in just a few minutes, but let's go over to Dr. Teo Lisa Almendras, the head of the UN Medical Service here at ESCAP. Dr. Teo, over to you.
Thank you, Roy. I have slides prepared.
Could you speak a little bit louder, Dr. Teo? Your microphone is a bit on the soft side. Thank you.
Hello? Is that better?
From my laptop, it's still a little faint, but maybe others can hear you better. Thank you.
Okay, then I'll try to speak a little louder.
Much better. Now
okay.
Thank you.
Okay. So thank you, Roy. Good afternoon, everyone. I'm just going to keep my camera off during my presentation. So keeping in mind that this session was planned to be the last one for the year, I would like to highlight some key points related to COVID-19 information that staff should keep in mind and where to find the information online. Next slide, please. So pertinent COVID-19 resources are available through your agency's focal points and on these websites. You can see the Bangkok Service Hub website has a COVID-19 link there, and then on iSeek. Next slide, please. So on the website, you will find the most recent information on safety measures and frequently asked questions related to phase 1 within the ESCAP premises, as well as the frequently asked questions in the COVID-19 helpline website. Next slide, please. So in the frequently asked questions document, you will find information on various issues, such as the health declaration, vaccination status disclosure, transfer of COVID-19 vaccination details onto a WHO Yellow Book, travel regulation updates, among others. I believe Kiran will place a link to a YouTube video that we made to ensure there it is. So if you don't want to read the frequently asked questions online, you can just watch the video. Next slide, please. Okay, so these important reminders have been discussed by Sumi in previous Q&As, but we wish to remind everyone again about the following to help ensure a safe and healthy workplace. Adherence to all safety measures in place, including wearing masks in common areas, self-thermal screening, physical distancing. Also, please be reminded again that if you or anyone in your household feel unwell, please stay at home and inform your supporting medical service for further guidance. Then there's a health declaration prior to entering the premises. mandatory vaccination disclosures either through the EarthMed portal or through your supporting medical service, which includes ESCAP medical service, and informing your supporting medical service immediately if you believe that you may have been exposed to a positive case or suspect that you may have actually been infected. Next slide, please. So again, as mentioned by Sumi in previous sessions, personnel must disclose their vaccination status either through the EarthMed portal or the UN Medical Service or their supporting medical service. Information on your status will only be accessed by medical professionals. This information is key to further develop and improve our risk mitigation measures within the premises. Next slide, please. So ESCAP Medical Service has an established protocol on how to conduct contact tracing in the workplace, including an SOP on cleaning and disinfection of identified at-risk areas. This safety measure helps to ensure that the infection does not spread any further to other colleagues who may have been exposed to the person who tested positive in the workplace. Next slide, please. On the Yellow Book transfer request, we kindly remind everyone that during phase 1, priority will be given to personnel who are required to work on site at least once a week and has obtained at least 1 dose of the COVID-19 vaccine outside of Thailand, or those who will be traveling outside the country within 1 to 2 weeks from the date of the request. For those who do not fall under these 2 categories, you may wish to obtain your vaccination passport through local organizations under the DDC, as you may see on the slide, or you can wait until ESCAP transitions to a higher phase. Also, detailed information on how to obtain the vaccine passport locally can be found on the Bumrungrad link in the slide. It has also been reported through several local news outlets that Thailand is planning to issue free e-vaccine passports for people going overseas. The Center for COVID-19 Situation Administration, or the CCSA, said last Friday that the electronic version of the COVID-19 certificate will be available for download on MoreProm application. The launch date for the e-version of the vaccination certificate will be announced later. And then the last slide. So travel information updates can be found on the UN Returnees Bangkok website, including how to apply for the Thailand Pass. Link is found in the slide. So this is my last slide. Back to you, Roy. Thank you.
Thank you so much, Dr. Teo. We've got questions, I'm sure, for you as well. But first, let's go to Dr. Rick. There is a question for you, Rick. It says, is there any clarification on the Thailand government policy for boosters/third doses? So, for example, is the government planning to provide these boosters for those that got the 2 doses of the AstraZeneca, etc., or for people who also got their vaccinations overseas?
So my understanding is that the policy really is that people should have boosters at some point, but priority is being given to the people who fall into the recognized risk groups. And in fact, priority is also being given to people who have not been vaccinated at all. So I think it's just kind of represents almost a stepwise approach to try and focus on priorities before shifting to give additional protection to people who will already have a degree of protection. And I think that should apply to everyone in Thailand, according to my understanding, including people who will have been vaccinated overseas. It's a way of ensuring that. I mean, I think my counterparts sincerely believe in inequity for access to health services. But it's also a way of trying to drive down transmission and to protect the healthcare delivery system from being overwhelmed. But to do it in a kind of stepwise manner based on some assessment of risk, I think is rational. Over.
Thank you, Rick. We have another question for you, Rick. Are there any updates on the Thai government policy to vaccinate kids under 12 years of age?
I think there is not any update at the moment. I've not heard any information about this, when it might be started.
Thank you so much. And another question for you, Rick, as well. Is there any information on the so-called long COVID phenomenon and the recovery rates thereof? And also, sort of linked to that, are there any significant differences in the long-term symptoms per different COVID-19 variants?
So taking the last question first, I've not heard this at all. Suggested that different COVID variants would have a different impact in this way. I actually have been pondering this question before, because we were planning to put some information in one of our situation updates at some point. And I did actually just a couple of days ago come across some information which suggested that, I mean, it has been recognized in this country, but the rates seem to be a lot lower than reported in other countries. But whether or not that is a kind of a detection issue or whether it reflects reality, I'm a little bit uncertain. So I know that's not a very good answer, but it's kind of on our radar as something that we want to get more information about, and we will put something in one of our situation updates quite soon about it.
Thank you so much, Rick. Once again, not surprisingly, there are some questions about travel with the holidays coming up, etc. And now with this new variant, of course, there are concerns afresh. So is there any WHO official advice from headquarters or from the Thailand country office for traveling in a country over the holiday period, specifically for Thailand, but also generally any do's and don'ts or any travel advice? Thanks.
I think the I mean, I've not seen it suggested that there should be any restrictions on travel. So I think the standard reply to this is that you need to follow, irrespective of what WHO might say, you really need to look at the guidance that's being provided by the countries concerned. By not just the. I mean, so if you want to travel within a country, you look at the guidance for that country. If you want to travel to another country, you need to look at the guidance for that country and also be mindful of what might be required when you return to your country. But I guess it's just a common sense thing that in a very dynamic situation, if you're a little bit unlucky, you could get caught out. So, even when people are traveling, sometimes the guidance can change. But I think what we've seen before is particularly, this has nothing to do with WHO, I should say, I'm just talking about what I've seen, that you just need to be a little bit mindful that if you travel to another country, the guidance for you to return may change while you're away. So I'm not sure if that's very helpful, but they're inevitably in a situation of uncertainty like this, where there's a lack of information and the situation may be evolving quite rapidly. You need to be a little bit careful, I think, before, while making plans.
Sure, of course. And I should also add, I suppose, that this also applies to travel within Thailand, because you've got all these inter-provincial rules that we saw changed all the time, when we were entering the wave back earlier this year, when suddenly one province was shut down to other provinces and so on. Let me turn to our colleague Kieran McGovern from the UNRC's office. He's the COVID-19 coordinator, and he's got some short updates for us. Over to you, Kieran.
Thanks, Roy. Hello, everybody. I've got a couple of things. The first one, I noticed a question in the chat function from Clement on the best way to sign up for boosters. Clement and others that are interested in boosted, we've just had some listening to Dr. Rick. It's an individual decision, and therefore seek your own medical advice on boosters if it is something that you wish to consider. Understanding the issues of equity and priority at an organizational level, this is something difficult to respond to. So if you're after boosters, do consult your medical practitioner, is the advice. Now, the second thing is that this is the last Q&A for the year. We've been through 24 Q&As, and it's also the last one that Roy will be participating in. So I just wanted to take the moment on behalf of us all, for Roy has volunteered his time and expertise week after week through the ups and downs of the different waves, and Roy will be leaving us and our Thailand country team over the end of year break. So thank you very much, Roy, for your concerted effort. You've brought a lot to communicating to staff the issues that have faced us as an organisation and us individually. So your touch has been appreciated, and on behalf of all the staff and our greater UN family, I say thank you and wish you all the best in the future. So with that, people, we will reconvene the Q&A looking back on about the second week of January. That'll give WHO the ability to look at any movements that might be related to New Year's festivities as well, and that we'll be able to give you a good better look at the picture. So with that, I hand back to Roy to do his final closing. The questions that I have listed, I'll address those individually. So back to you, Roy.
Thank you so much, Rick. Kieran, for those kind thoughts and words. And I just want to say that I'll still be connected with COVID-19, perhaps even more so because I am going to the World Health Organization's Copenhagen hub, which covers Europe and Central Asia, starting in late January. So thank you all for having tuned in week after week for these last several months, and for the opportunity. And so, as we just heard from Kieran, this is, as of now, the final COVID-19 session for this year, and we'll be back with a new round in the middle of January, and that notification will, of course, be sent out to all staff. So with that, stay well, stay safe, happy holidays to all of you who will be celebrating, travel safely, and we'll see you soon. Take care. Goodbye.